So palpating for trigger points in the upper trapezius. The first thing we want to try to do is our gentle palpation. What we're looking for there are subtle changes in the skin, like increased sweating. So what we start doing is we slowly run our fingers gently over the area. And you'll notice areas that feels like your finger drags or catches a little bit. That can be evidence of increased sweating, so there might be trigger points underneath. Now make sure to tell your patients what you're doing, because it feels kind of off-putting just to have someone gently rubbing their fingers over you. Okay, and then we have a couple different options for palpating through the upper trapezius. The first is our flat palpation, so taking a broad contact, and we're going to go cross fiber all the way through the muscle here. We're looking for taut bands. So a taut band is a specific area of the muscle, usually running from origin to insertion, that the whole thing feels tightened. Okay, so we can do our flat palpation. Or we can try our pincer palpation, where you grip underneath both edges of the upper traps here and slowly roll through that muscle. Okay. Once you identify a taut band, you want to search from end to end and see if you can find either a nodule or a specific part of that muscle that's tighter or more tender than the rest of it. Okay. In the traps, they're commonly found kind of right in the middle of the belly. And then on this free border, so remember the traps comes around and attaches to that meat or lateral third of the clavicle, and it kind of folds over on itself. If you get your finger under, you can almost feels like you can unroll it. And there's often a little trigger point right in through here. Okay. Getting your patient feedback. Sorry, I'm just making sure we're actually recording. Getting patient feedback, how they're feeling, as well as what you're feeling. Okay. So after you've identified where you think the trigger point is, we can warm up the muscle, and you can do this using your regular general Swedish massage, or this is a good time at the beginning of the treatment to use some of our myofascial techniques that we practiced in the first half of the course. It's a good place to do a shape and mold or a cross hands. But make sure they're warmed up. After the muscle is sufficiently warmed, we have a couple different options again for applying pressure to that trigger point. So we can come in with our pincer palpation if their anatomy and your anatomy allow it, where you're just going to use your thumb and forefinger or thumb and a couple of fingers there, come on either side and apply pressure there. Now, trigger points can be a little bit painful, but it should always be, if it is painful, it should be that good pain. It should be satisfying. If you notice their breathing increase or them trying to pull away, it's probably counterproductive to work with that much pressure. So getting a pain value from your patient to start, so let's say she says that's a 5 out of 10. And all we're going to do now is we're just going to hold until that pain decreases. Sometimes with trigger points you'll find that the pain increases a little bit at the beginning before decreasing. And sometimes you'll find with referral, if they're experiencing referral pain, that referral pain won't come on for 20 or 30 seconds. And while we're here, it's good to remember that the upper traps refers up the side of the head into the temple in this classic question mark shape. Okay, so holding that until the pain hopefully goes away. If you feel like you're holding and that pain isn't changing or going down, try relaxing your pressure and then coming back in with a lighter pressure. So let's say originally she was at a 5 out of 10. We can try her starting at a 3 out of 10. If it's too high, sometimes there's too much of an SNS response and it just won't relax. The other way I can access upper traps here is, okay, normally I would stand this way, but you guys won't be able to see what I'm doing, so I'm just going to stand here. You can just press right in with your fingers and through here. I like to keep my other hand on the inferior angle of the scapula just for support, but you can also use that hand to support the other hand. And again, we would just hold until that pain decreases. Some people like to do a pulsating pressure where you're pressing for 5 seconds or so and then releasing for a couple seconds. And pressing for 5 seconds or so and then releasing for a couple seconds. Again, until that pain goes down. I prefer just to hold, but that's a matter of personal preference. So once the pain's decreased, we have a couple options. We can just decide to end the pressure portion of the technique there and slowly come out, or we can add more pressure to bring them back up to that original level. So let's say they were at a 3 originally, adding that pressure, going deeper until they're at that 3 again. And you can repeat that process 2 or 3 times, each time adding a little bit more pressure. After we've finished with our compressions, we will get our patient to turn over. Turn over for me, please. And slide on the table. Thank you. So after we've applied our pressure, that pain's gone down, we want to fully lengthen the muscle, so stretch it. So with the traps, I'm going to support underneath her head here. I'm going to side bend contralaterally, rotate ipsilaterally, and stabilize here at the shoulder. Now I did that backwards. It's usually better to stabilize at the shoulder first and then bring that neck into that stretch position. That little bit of ipsilateral rotation really focuses it into those upper traps. You can choose to just do a static stretch like I'm doing here, or you can do a contract relax stretch. Most sources recommend a contract relax stretch following the trigger point release. So to do that here, I would get my patient to gently push her shoulder up into my hand. So gently push for 5, 4, 3, 2, 1, and relax. So a 5-second contraction followed by a few, 2 or 3 seconds of relaxation. Then you're going to gently increase the stretch. So either pushing that shoulder down a little bit more or bringing that head over a little bit more. When stretching muscles in the neck, it's usually better to try to increase the stretch by stabilizing the shoulder more rather than wrenching the neck over more. And the other way you can get that trap to contract, I use my forearm here. I bring my forearm over to the side of her head and say, can you gently push your head into the side of my arm for 5, 4, 3, 2, 1, and relax. And increase that stretch a little bit. Usually after 2 or 3 contractions, you will notice that you're not getting further gains. So then we hold that final position for 30 seconds. Okay, and you know from my exams that 30 seconds in demos is a lot shorter than real life, so let's call that 30 seconds. Come back to neutral. And then the last part of the protocol is to reset the muscle with a passive and active range of motion. With muscles that have a couple actions or multiple actions, trying to get them to do at least 2 of those actions is preferable. So for the upper traps, I'm going to side bend. 1, 2, 3. And then I'm going to ask her to do that actively, but because it's a neck muscle, I don't want her having to hold her head off the table. I'm going to support the weight of her head and say, can you just do that motion for me? 1, 2, 3. Great. And then we're going to come over to the shoulder, and we're going to shrug the shoulder 3 times here. 1, 2, 3. And if you could do that for me 3 times too, please. Great. Right, the resetting doesn't need to be done immediately after you've done the compressions. You saw how I had to turn her over to do that reset. Usually in the context of a treatment, it doesn't really go with your flow. So as long as they do this little process before they leave your room, that's fine. Sometimes you can do it with them after they're dressed, before they leave, just as long as they do it at some point.